Okay, so types of shock commonly associated with trauma. So we have hypervolemic, we have cardiogenic, and we have obstructive. We just touched on these briefly. So hypervolemic, volume of the blood throughout the entire body. Cardiogenic has to do with cardio problems that don't allow perfusion and, perfusion happening in the body. Obstructive, there's something blocking somewhere. There's a embolus or embolism that is blocking and keeping the blood from moving through the rest of the body. So hypovolemic due to inadequate circulating blood volume. I'm struggling today. Most common cause is hemorrhage and dehydration, and then we have hypotension, tachycardia, anxiety, and confusion. Hypotension and tachycardia could also be caused by anxiety, leading to confusion. 20 milliliter kg bolus, PRN. Cardiogenic. Compromise of cardiac output despite the adequate circulating blood volume. This is going to result from heart failure, cardiac tamponade, myocardial infarction, third-degree heart block. Most common cause is a myocardial infarction, death of muscle in the heart tissue, heart muscle death. That is what that would translate into from Latin. Obstructive, inability to produce adequate cardiac output despite normal blood volume and myocardial function. Results from cardiac tamponade, tension pneumothorax, pulmonary embolism, difficulty breathing, and underlying issue. You're going to see JVD, underlying issue. Tachycardia, anxiety, and confusion can also result from this. So and all these treatments are roughly the same with the exception of cardiogenic shock. So the rest of these, you're going to give larger amounts of saline. So hypovolemic, we're trying to replenish that volume. With obstructive, you're also trying to make sure that, if anything, you'd cause the veins and the blood vessels, arteries to get larger with the amounts of volume that's in them, so that way maybe that obstruction can be pushed on a little bit further and allow passage. Also allow the saline solution to help dissolve it. Most likely not going to happen, but any little bit helps. Now cardiogenic, it has to do with the heart. Giving more fluid is not going to assist that, but we'll give a 100 to 200 milliliter bolus just to increase the blood pressure at least. But we're not going to give the same amount that we would with either of those two options. So if we look at the stages of shock, compensated, right? Your body is compensating for it to try to push it back into where your body can get back to homeostasis. Mild tachycardia, so the heart's going to pick up. AAO, altered, I'm not sure. Lethargic, lazy, slightly confused, restless, anxious, delayed cap refill, right? So if we push here and there's a delay in refilling because this is proximal to the heart, same with your toes. That's why that's a good measure of seeing shock. BP, normal or slightly elevated. Decompensated shock. You're going to have moderate tachycardia, so heart's going to be beating faster, confusion, unconsciousness, delayed cap refill, cold, extremities, cyanosis, that graying or bluish blue of the skin, BP decreased, systolic and diastolic blood pressure. That's why we would give fluid, so we could increase BP. Irreversible bradycardia. The heart's tired at this point and it is slowing down. Severe dysrhythmias, coma, pale, cold, clammy skin. BP, frank hypotension. I don't know what frank means. If that's like a special word or if that means, I don't know. No. Go back. Here we go. Scuba diving emergencies. So we have diving gas laws. We have Boyle's law. If the temperature remains constant, the volume of a given mass of gas is inversely proportional to the absolute pressure. When pressure is doubled, the volume of the gas is halved, popping or squeezing sensation in the ears. Dalton's law. Pressure exerted by each gas in a mixture of gases is the same pressure as that gas. Henry's law. At a constant temperature, the solubility of a gas in a liquid solution is proportionate to the partial pressure of the gas. Descent diving injuries. So the squeeze, this is the result from the compression of gas in an enclosed space, such as the ambient pressure that increases with the descent underwater. Bleeding from the nose, ears, think eustachian tubes. Sensation of fullness, headache, disorientation, vertigo, nausea. I was a lifeguard at Discovery Cove through SeaWorld in Orlando. We were doing lifeguard training, and we had to get to the bottom of the dive tank where people would go underwater with heavy air snorkel breathing apparatuses, and they could walk on the bottom and see all the fish and everything at the bottom. Now, it was about a 30-foot drop. In case we ever had to rescue somebody, we had to be able to swim down there, grab sand, bring it to the top, and show it to our instructor. One guy swam down there, came back up, blew his eardrums out, so he was bleeding from his nose and his ears. He was not a lifeguard anymore at that point, at least in training. Disorientation, vertigo, nausea, all of these can occur. Scuba diving emergencies, ascent injuries if you come up too fast. Air embolism, the most serious complication of a pulmonary barotrauma, major cause of death and disability among divers. If you're in an environment like this, panic is typically what is going to kill you. Occurs when ascending too quickly or holding your breath while ascending to the surface. The diver loses consciousness immediately after resurfacing. Signs and symptoms, there's going to be difficulty breathing, stroke-like symptoms, vertigo, confusion, visual disturbances, focal neurologic deficits. Management, we want to give oxygenation and airway protection. Transport the left lateral recumbent position and hyperbaric oxygen therapy or recompression. Decompression sickness, also known as the bends. Diver's paralysis, Caisson's disease, diverism. Multi-system disorder that results when nitrogen is compressed, air converts back from the solution to gas, results in formation of bubbles in the tissue and blood. Henry's Law. Signs and symptoms, you're going to have joint pain, rashes, itching, bubbles under the skin, chest pain, cough, shortness of breath. Management of this, we're going to give oxygenation and airway protection. Transport, again, in the left lateral recumbent position, hyperbaric oxygen therapy. Recompression. Nitrogen narcosis, rupture of the deep. Nitrogen becomes dissolved in the blood and crosses the blood-brain barrier, causing central nervous depression, effects similar to alcohol, which can severely impair the diver's thinking and lead to lethal errors. Usually becomes evident at depths around 75 to 100 feet. If we're looking at environmental emergencies, we have hypothermia. Core body temperature of less than 95 degrees, you will lose the ability to shiver. You're going to get an Osborn wave, also known as a J wave. So again, we have our wave QRS here. So this is our P wave, Q, R, and then an Osborn wave or a J wave. If you see, let's see, J's are shaped like that. So it's like an upside down J. I don't even see a U wave. I think you could get T wave, and then there's U waves potentially that you would see. Let's see if it talks about that. So maybe present at the junction of the QRS and ST segment. So ST segment, QRS. Mild hypothermia, 89.8 to 95 degrees. Moderate hypothermia, 82.5 to 89.7. Severe hypothermia is less than 82.4 degrees. You're going to have an increased risk of ventricular fibrillation. Management, we want to handle with care, move to a warm environment, and start the rewarming process. Remove all wet and cold clothing. We want to stop the cold from happening before we start the warm. Heat exhaustion. CBT, up to 103, central body temperature. Signs and symptoms, you're going to have severe cramps, dizziness, nausea, profuse sweating, headache. Management, we want to move to a cool environment, administer replacement fluids, cool patient with cool water spray. If they have heat stroke, there could be confusion and irrational behavior, could be a coma, flushed skin, pulmonary edema, dysrhythmias, GI bleeding, clotting disorders, reduced renal function, hepatic injury, electrolyte abnormalities, sweating may be absent in this case, For management, we're going to move to a cool environment, and we are going to keep cool by fanning. We might wet them. Administer fluids. Administer benzodiazepines for seizures, such as Versed, midazolam. Trauma study guide. A deeper dive. Kinematics burns. Babies. Medical emergencies. Yeah, that's a good stopping point.